Coming up after the break, you've heard of a facelift. What about a body lift? Don't miss this story. Coming up next, only on Fox. Only on Fox tonight, Stairmasters, diets, they sound like practical solutions for weight loss.
But they don't always do the trick. Tonight, Elsa Ramon shows us a radical procedure that's unlike anything you have seen before. Elsa?
Robin, it happens to a lot of men and women. Getting rid of those extra pounds sometimes leaves behind extra skin. But a procedure performed right here in the Valley is changing all of that. It's called the ultimate body lift. First, a warning though, some of the video may make you a little uncomfortable. Climbing countless steps, walking endless miles, and pumping heavy iron can't always cure your problem areas.
I have a very small frame, and I have small legs up to get right above my knees. And then I have these problem areas in my thighs, my rear end, and my stomach.
We'll call our patient Mary. She doesn't want people to know she's having this surgery, but says she needs it because the strain of childbirth stretched her skin to the point of no return.
I'm a fairly small person, and after having 2 children, my body's kind of taking a toll on my body, and after diet and exercise, I realized that I needed a little bit more assistance.
Other women do it because their weight gain is like a yo-yo.
There is probably a misconception that if you just work hard enough, you can get skin to contract. And skin is an organ or a tissue that really genetics has a lot to do with it.
Dr. Jeffrey Ptak will perform a procedure that combines liposuction and abdominoplasty with a buttock and thigh lift. It's literally the ultimate body lift.
If you were to just do liposuction, you would still have a lot of this looseness. But when we do the lifting procedure, you can see that we're going to get a lot of lifting and a much more youthful contour.
Colored pen marks act as a guide. The area between the red lines will be removed and connected, while the black line represents the hairline scar that will serve as Mary's reminder. Mary's rolled into the OR. Her new figure is now just 7 hours away. In surgery, Dr. Ptak first liposuctions the back of her legs.
She's got a real average, if not just a minimal amount of fat to be suctioned back here.
Carefully following his map, the doctor removes extra flaps of skin and fat. He's now ready to stretch and connect the lower and upper sections.
As the tighter you lift, because of a deeper tissue, you get a tightening and a constricting effect that actually tightens the legs circumferentially all the way up to the hip bone.
Mary's left side is finally finished, and Dr. Ptak carefully stitches her together. Although there are several hours left of surgery, you can already see a difference.
You see still it's there on the right side. That's all gone now, and you can see how tight this is and how the incision just follows the curve of the buttock.
Like an artist, Dr. Ptak finishes sculpting both legs before repairing the abdominal muscles. Mary will now spend the next couple of weeks recovering. 4 weeks after the surgery, this is her reaction.
Wow, I can't believe it.
The results are incredible.
I think there's been a tremendously increased youthful appearance of the buttock. Not only in how much it has shrunk three-dimensionally, but also in the tone and the laxity of the skin.
A red scar that's tucked away in her panty line will eventually fade. The now size 4 mother of 2 finally has the youthful figure she remembers, a figure that now needs a whole new wardrobe.
My old pants I can pull completely down without even unbuttoning or unzipping them because I've gone down so many sizes.
Pretty extreme. Dr. Ptak says for the majority of the patients, the ultimate body lift is a one-time procedure. However, the younger the patient, the greater possibility they may need a touch-up down the road. If you're wondering how much one of these lifts costs, they're anywhere between $15,000 to $18,000, Robin. It's a lot of money.
Wow.